like it's going to have to go away.
So it's always there.
It's always there. It's
Always there
always
on your shoulders.
yeah, in the back of my mind.
On your shoulders.
On my shoulders, yeah.
And that's no good, is it?
No.
So Max, when was the last time that you were happy? Really happy?
I think it was that trip away, that weekend away that we spent at the beach. I was able to put things behind me, kind of thing, and just focus on what was happening there.
So you're in the now at the beach?
Yeah.
You left it all behind?
I haven't been able to do that.
So what made that time different?
I'm not really sure. I think there's probably a combination of things. The atmosphere and the environment, a very beautiful place. Just everybody really enjoyed themselves,
So you forgot?
I forgot, yeah. It's just got wrapped up in their excitement.
So when you forget and you're in the zone, you're in the now kind of thing, work goes away. Why doesn't it go away a bit more?
I think it's because it's eating up more of my life now. I needed to do these extra hours, and then I'm more tired when the kids come home. I guess I'm more short-tempered and stuff with them, which makes me feel bad because they don't really deserve it.
But it's tough for you. It's tough for you when you're tired.
Yeah.
When you're not as tired when you're tired. So when you've been thinking this way, you've been thinking, I should be more tolerant. Well, what have you done about that?
Well, I try and be mindful of what I'm saying and doing, but that's just another thing on my shoulders, that I have to take responsibility for.
And your shoulders are pretty big right now, aren't they? And pretty heavy.
Yeah.
But what I mean is, what have you done to break that cycle, to do something for yourself so you can forget again? What are you doing to forget?
Yeah, well, that's the thing. I haven't really, I will take time for myself. I've got obligations to other people when they come first. I don't think.
But you're no good to them if you're worn out like a hard worker who falls over at the end of the day.
Yeah, that's true.
Okay, I think there's some good emphatic statements in there. Do you want a shot?
Yeah.
Yeah, whatever.
Hello,
Hi.
my name is Munif.
Hi, I'm Max.
Matt. Yes, Matt, how can I help
My wife sent me to counselling, and she suggested I come to counselling. I've been quite unhappy lately.
you? Your wife, she sent you to counseling.
Yeah. Well, she asked me to come, send me. Yeah.
Good. What have you got in your heart now to say and to get it out of your heart? Exactly what's bothering you?
Just sadness, I suppose. I don't feel any excitement for life anymore. I don't get any joy out of anything.
Any children?
Sorry?
Children?
Yeah, I have 3 children.
3 children.
Yeah.
That's good. Well, first of all, whatever is going to be said here is staying here. Nothing is going out. Everything is here. But I think it's a good sign if your wife sending you for counseling. That's a positive sign.
Yeah. Yeah, I know she's just concerned for me.
Right. Oh, that's very good. Do you work?
Yeah, work a lot.
You work a lot.
Yeah.
Very good. How long time it has been going to this?
About a year. Yeah. It wasn't so bad. I just sort of started noticing it. That, you know, there's feelings, there's times of feeling down. And I sort of try and hide it. But, yeah, it's just gotten worse, and you know, I just feel down all the time.
So it wasn't too bad.
No, it wasn't too bad at the
Wasn't too
beginning.
bad.
Yeah. But now it's all pervasive, you know. I wake up feeling like this, I go to bed feeling like this.
Do you think the more you are thinking of it, the more you are, it's getting worse?
Yeah, I think so.
Yeah.
It's always on my mind. You see, so,
Always.
yeah.
Have you got an idea what to do or what to think or what to... Have you ever thought of something different? Like going and taking the kids, taking your wife?
Yeah. I think I just need some me time, you know, but I don't feel like I should put myself first. You know, I've got my family and you know, they're more important to me. So I have to look after them first.
That's very good responsibility.
Okay, good. We're already at 11:45, guys. We've been doing that for a while, so I don't know if you feel worn out. Okay, so I think we should have a quick discussion about it. If one thing's clear, it's probably that all of those rules that go with PCT, if you're trying to take a traditionalist approach, are easier said than done, and it's probably more realistic that you're going to integrate rules from different frameworks. It's just more realistic. But what do you guys have to say? What worked? What didn't work? What did you find hard? What did you think?
Towards the end, it seems that I'm pleased we did this because even when you and I were doing it before, it didn't quite click, but it has that paraphrasing and those key words. I think, yeah, that's right.
You can stick to the paraphrasing and that, but if they don't talk, you've got to throw something in there that they've talked about before so that you're not
Exactly.
completely off the track.
Yeah.
But you made it difficult because you were really not giving much.
And that's
Yeah.
just realistic, isn't it?
And
If the
even-
client's not sharing.
Even the silences were long. I tried to let them go out, but, you know,
I think
hoping that
Gita
you'd get
actually-
uncomfortable and talk, but you didn't.
I think Gita actually did the best at
Yeah.
getting me to talk about the reasons why I was feeling down,
Yeah.
the feelings behind by
You-
focusing on.
You keep giving me I'm lying signals. You keep
Oh
touching
no,
your
I
nose.
just got an itchy nose.
He's like, I'm telling a lie now. I'm telling a lie now.
I think you're right. Gita did focus a lot on reflection and feeling and conveying empathy,
Yeah.
and now that's kind of one of those sort of invitation to keep sharing more about that particular feeling or those
Yeah.
issues.
You've got to be on their side, you know.
Yeah.
And he obviously had the whole world, everyone's problems on his shoulders, and nobody else was focusing on that. So he couldn't relax.
And while some people did end up taking a little bit more control, inevitably they were looking for more information to build some sort of assessment on this client. So it's not. So I guess it comes back to when you do your pracs, maybe your pracs aren't realistic in that sense, you know. But I think I think mostly everybody did a pretty good job at least trying to think, how can I avoid swaying or directing this client, even if they had to end up doing that, because otherwise they've got nowhere to go. I think everybody was trying pretty hard. Definitely fall back on paraphrasing and coming across as empathic toward the feelings. And hopefully if the client feels that, then they'll take it as permission to share.
All right.
Okay?
Yeah.
No other statements or questions or anything? All right.
Concentrate on
No, it's actually
key
good
words.
in a way because it pushes us to try harder when you don't
Yeah.
give.
That's right.
Or if somebody's really resistant, it makes us work harder too. So
And that's
like
actually
Margaret was really resistant the other day, remember?
Yeah.
I do
She
remember
was
that.
quite aggressive and that made it hard,
Yeah.
you know.
But
She-
sometimes you can sort of like have the resistance just for a little bit of a challenge, and then you think, oh, I really want to push
Well,
hard.
that's kind of why I told him not to be too open and to occasionally not want to share, actually. But in Margaret's case last week or whenever it was, she wasn't suitable for that form of therapy.
That was
form-
CBT.
Yeah. All right.
What would you tell him, Brother Rick, yourself?
What would I tell him?
Yeah.
I wouldn't tell him anything. I would go down the kind of path Gita went down and keep reflecting back his feelings and empathy.
Right.
But having said that, even I was thinking a couple of times there, he's shut up, he's not sharing anymore.
That's
We're going to
right.
have to ask one of those information gathering questions to help this move forward.
That's
I
right.
always, I thought when I was listening, I thought, yeah, he's going to shut down in a minute,
Yeah.
because like so many, he went over the story about so many times why he came to counselling, and I thought, yeah, he's going to shut down in a minute because he's going to get sick of saying
Well,
the
that's
same.
because we had the tag team
And-
though.
And the thing is, you could also, if he does shut down, you could, if we're taking an integrative approach, ask or make a statement like, do you not want to talk about that?
Yeah.
Because maybe he does, maybe he doesn't. You just might want to check. Just because he shuts down doesn't necessarily mean you've got to run away from it.
No.
Just confirm that he doesn't want to talk about it. You never know, maybe he does, he's just looking for permission to do so.
Because I could tell
What's the
that
point?
he sort of went a little bit quiet for a while. I was sort of reading what he was doing, and yeah, he was going a little bit quiet for a while. So he's going to shut down in a minute. He's not going to want to talk.
But there was one specific thing that I was sort of looking for, and that was permission to feel that I could put myself first and feel these things. And
We were getting there.
Family,
you got the
yeah.
closest.
Yeah.
That's why I think I started to open up more. But that's, he's the kind of guy, he's really not comfortable with complaining and saying,
Yeah, you pick another one kid there.
But that's our job, to listen to your troubles. I mean,
yeah,
Didn't
You
even
know?
recognise it, but yeah. yeah.
But he didn't open too much, did he?
no.
I don't know.
Boys don't like to talk much anyway. I have 3,
Boys,
yes.
yeah.
And a lot of times they don't like to communicate with me face to face. So it's always usually like you sit beside them or do fishing or something like that to try and get the conversation
Right,
happening when
right.
they're feeling down. And most words that I always use is could. I never use should, because that gives them time to think where they have a choice. They could be doing that, not me saying you should be doing that.
no.
That's a good point as well.
Would
In
you
the
do
end,
that?
it's difficult to apply a framework, any framework, some more than others. Like PCT relies very much on that rapport and the development of the therapeutic relationship. It's hard to just throw yourself straight into it without building trust and having the client recognise over time that he's welcome to share in a safe environment. Okay?
Okay.
All right, well done,
Thank
guys.
you.
Appreciate your input. Thank you.
Thank you, Brother Rick. Thank you, everybody.
No worries.
That was great.
Thank you.
Okay, Jen, what's that down?
Oh,